Stephanie. I'm a physical therapist from Motion O.C. Today I'm going to talk to you a little bit about IT band syndrome. So this is really common with people that are active runners, cyclists, hikers, and it can present as outside kind of leg pain, either in the hip or the knee. So first we'll kind of go into what an IT band is. So it's actually a tendon that runs all the way from your pelvis and your hip bone all the way down into your knee. So sometimes it presents as kind of outside knee pain, and people just think that that's what they have, is some sort of knee dysfunction. Others will complain about it being a little bit more on the outside of the hip or all the way down into the middle of the leg. But really this is a large tendon that attaches the muscle from the top, kind of the glute area, and it wraps it all the way down into the outside of your knee. So it doesn't actually have a muscle connection, but it's rather just a band. That's why for people that it has irritation to that area, you can probably feel it on the outside of your leg. It's a little bit harder than your typical muscle. So what happens is that this tendon becomes inflamed, and often with repetitive bending and straightening motions. That's why it is so common for runners and cyclists and hikers, because they're constantly doing that bending and straightening of their knee. So it actually is something that you should think of not as this is what's wrong, that IT band syndrome is wrong, but it's more of a symptom. So its presentation is based on either a functional cause or a structural cause. So functionally there can be different muscle imbalances because it does kind of surround all the muscles of your hip and the knee area. It can be a lot of different areas that are impacted. So muscle imbalances, if one is too strong or too tight, it can kind of present as irritation to that area. Another reason would be structurally. Sometimes people that might have a little bit more flat feet cause the whole lower body to just kind of change. So the knee is going to go in a little bit more, the hip's going to go in, and it's just going to have different pulls on that tendinous band. So here in physical therapy, we'll really try to help get that pain down. That's going to be the first line of action, is trying to get you to be able to tolerate your daily activities and really control that pain. So we do that through different taping mechanisms, manual therapy techniques, different types of modalities, a lot of different options for you. But then we really go into what's the cause. Why did this happen to you? So that's why we'll go through and evaluate and give you your own personalized an individual plan, as well as education on how to prevent it and kind of what to do going forward. So come on in to see us at Motion O.C. We'll give you a free consultation, just kind of see what's going on, figure out if this is something that is occurring for you. So we'd love to have you come on in and meet you. Thank you.